Welcome to this discussion of your DNP practice experiences in the Texas A&M University Corpus Christi College of Nursing and Health Sciences. This presentation introduces your DNP practice requirements along with some of the resources and tools that are available to students and faculty to understand and manage these experiences. The DNP Handbook is intended to serve as a guide for students and faculty in the DNP program. It's a dynamic document that will be updated as appropriate and reflects the evolution of the program. For this reason, it's important that students become familiar with this document, and if you choose to download the document to your computer, it's important that each semester you go into the ConHS website to access the most current version of the handbook. Here's a short demonstration for how to access the DNP handbook on the ConHS website. The best way to find the most current version of the DNP handbook is to go to the College of Nursing and Health Sciences. And the easiest way to do this is to go to the website, the Texas A&M Corpus Christi website, go to Information for Students, click on Nursing and Health Sciences, then go to Current Students, scroll down to Graduate Students, and then there is the DNP Handbook. This will always provide you with the most current version of the DNP Handbook. You can also find links to the most current versions of the DNP Handbook and other important links in an area on your My Island On homepage. When you log into Blackboard, if you look on your homepage in the left-hand column, you'll find a section titled My Organizations with a link to the Doctor of Nursing Practice Organization. All DNP students should have this organization on their homepage. If it's too far down on the left-hand column list, you can sort this area to the top of the list by clicking on the arrows in the upper right-hand corner of your screen. You'll want to click on the organization periodically to access resources and to read new information that might be posted in this area. The AACN DNP Essential Competencies address the competencies that are core to all advanced nursing practice roles. Your practice experiences in the DNP program are aimed at helping you to meet your program learning outcomes, which are based on these AACN essential competencies. The TAMU-CC DNP program learning outcomes are located on page 6 of the DNP handbook. You can see a link to the essentials above. It will be very important for you to have a working knowledge of the DNP essentials. Your practice experience as well as your didactic coursework are all aimed at helping you to meet the learning outcomes described in the essentials. All practice experiences in this program will be linked to one of the 8 essential learning outcomes. In the DNP handbook, you will find a description of the various supports for student practice success. The following individuals will facilitate student progress in their project and practice experiences. First, we have the DNP Program Coordinator. The DNP Program Coordinator is entrusted with the overall leadership of the DNP program. This individual is responsible for the design, implementation, and evaluation of the DNP program, including curriculum, practice oversight, and compliance with national accreditation and certification standards. The DNP Program Coordinator is responsible for administering the policies related to the DNP program and supporting students as they progress through the program. The Faculty Liaison is assigned by the DNP Coordinator, and they assign each student a faculty liaison at the time of admission to the DNP program. The faculty liaison is a full-time TAMU-CC tenure-track faculty who is considered an expert in the student's area of scholarly effort, or will support the student in finding such an expert. The faculty liaison will remain an advisor to the student through graduation unless a change is sought by the student or is necessary due to a change in faculty circumstances. Students should be in contact with their faculty liaison from the start of the program. The liaison conferences should be documented in the Typhon time log as instructed by the liaison. Please refer to the DNP handbook for a complete explanation of the role, but you can expect the liaison to meet with you periodically to review your Typhon entries, to evaluate your progress in your personal practice objectives, to coordinate with your project advisor and your content expert, to approve the focus of your DNP project, to evaluate your finished project, and generally to assist students and monitor them through the successful completion of the DNP program. Each student will select their own DNP project advisor in the second semester of their first program year. So it'll be in spring. You start in fall, so in spring you should be selecting a DNP project advisor. The project advisor should be a full-time TAMU-CC tenure-track faculty member who will provide expertise as the student identifies experiences relevant to the DNP project. The project advisor will serve as a guide to the student through the completion of the DNP project and will work with the student's faculty liaison to approve the focus of the DNP project and to assist in evaluation of the final project. The project advisor should be an expert in the DNP project area of focus or should assist the student to determine whether an additional team member, a content expert, will be useful in designing, implementing, or evaluating a quality project. In some cases, a student will need a content expert. This is an option, and it will support the completion of the DNP project. This person is intended to provide specialized expertise to support students with content-specific support, insights, and/or networking opportunities. This person does not need to be a full-time TAMU-CC faculty member, but they must work within the guidelines of the TAMU-CC ConHS DNP program. The content expert may be a regional, state, or national, or even international expert in the student's specialization. Don't hesitate to reach out to that person that wrote the article that is the seminal article on your project or that provides the most evidence for your project. Students are required upon admission to the DNP program to submit documents confirming their licensure and compliance with the Texas Administrative Code requirements for students enrolled in health profession programs. All students must be in compliance with their Castle Branch documentation to be in the practice setting. If you have individual questions regarding the descriptions and requirements, please look in the DNP handbook on pages 8 through 10. And this will help you if you have special individualized questions about TB requirements and things like that. Students are required to purchase professional liability coverage through the university. The fees for this coverage are included in the fees that are paid at the time of registration at the beginning of each academic year. Students can find the most current liability insurance verification form in the Doctor of Nursing Practice Organization Practice Information link. Texas A&M Corpus Christi does not require affiliation agreements or contracts with practice sites. We do require a letter of agreement from the practice agency, and that would be giving you permission to be in their site and having access to their records or anything else that the student needs to access while they're there. We do require a preceptor agreement when a preceptor is used. If your practice site says, well, we need a contract or we need an affiliation agreement, then we have steps for you to follow to make this happen. You will complete a contract initiation worksheet and make sure that it's filled in completely, and then you'll send it to me, Christy Day, at tamucc.edu. Then I will look at the form and I'll submit that to the college, where the system will search for an existing contract. If there is a contract in place, then I'll get back with you and say, okay, we have it here, that's fine. Usually the agency will be the one to tell you if there's a contract. They should know because they're the ones that are asking for the contract. But sometimes they have changed leadership and things like that, and so they may even ask us for a copy of the contract or the affiliation agreement, and we can do that. If there is not already a contract in place, the university will begin the process of contract negotiations. If a new contract is required, you should allow 2 to 3 months for completion. So this should happen early in your program. I will communicate with the student as updates are received during the contract process. And if you have questions, feel free to call me on my office phone and leave a detailed message. Practice experiences should be completed under the guidance of the student's faculty liaison and a preceptor or facilitator. Students should identify preceptors or facilitators in their community who will help them access resources, key stakeholders, and opportunities in which to complete the work relevant to the DNP project to meet program objectives. Preceptors are experienced professionals who guide students in their work within the experience and provide feedback regarding performance. NP students are usually very familiar with this model from their MSN education, and it can be a little bit different in the DNP education. You may do your project without a preceptor in the site and may have a facilitator instead. But on the other hand, you may spend time with a preceptor to have more specialized education before your project. Facilitators are professionals who provide access to sites and resources, but do not provide supervision for the student practice. Sometimes the DNP student APRN has the highest level of practice expertise within the agency. In this case, there will be a facilitator from the practice site who will allow access to resources and help the student complete this project at the site. For example, if a student is completing a project implementing clinical practice guidelines within a site, then they'll need to access patients, talk to providers, nurses, and staff, maybe train them, and then they'll work together as a team. So an administrative facilitator would be very helpful in this case, or maybe even a medical director. The DNP handbook has more information about the preceptor-facilitator agreement along with the forms. In the organization in Blackboard Doctors of Nursing Practice, you'll find a Word document version of the agreement. You should submit your agreement to your faculty liaison, and all agreements must be approved before beginning practice. Your practice site administrator should prepare a letter on their letterhead to indicate that you have their approval to access HIPAA-protected healthcare information and to complete your project at the agency. And this letter should be uploaded into your Typhon external documents and submitted to your faculty liaison. Sometimes students have to move out of state while they're enrolled in a DNP program. If you plan to move out of state during the DNP program, this could impact your ability to complete your practice requirements. Please notify your faculty liaison as soon as you find yourself in this situation at any time during your program. There are a specific number of practice hours that need to be completed in each course to stay on track for graduation. In the DNP handbook on page 16, there's a table, and it's seen on the screen, of the required practice hours to complete in each course during the program. Students should refer to their course syllabus and their course faculty for specifics about the number of hours to enter into TIFIN each semester. The faculty liaison will approve the TIFIN time log. When you enter your time into TIFIN, the practice experiences will be categorized as either synthesis hours or immersion hours. And there's much more information and explanation on this in the DNP handbook on page 15, and also your Doctors of Nursing Practice link organization in Blackboard. In order to log into TIFIN, students must register for TIFIN and pay the required fee. Once this is done, then they will get a message from TIFIN in the email. And here, there's a sample of a message. And be careful because this message is timed. Once it's sent out, you only have 7 days to log in. And then if you don't do that, then you need to contact Marlene Falcone in order to get a new message link sent to log in. When you log into TIFIN, this is the home screen that you will see. You can see in sections 1 and 2 that there's lines through these, and these are not editable. We can't take out the case log management and the case log reports. You remember when you were in your MSN program, you may have had to report on your patients. You are not going to be doing that in your DNP program. Instead, what you're mainly going to be using in this TIFIN is section 3, other activities and reports. And also a main section will be the video tutorials, and we'll talk about that a little bit more as we go. When you click on the video tutorial link in the home screen, it'll take you straight to this introductory video, and it automatically starts playing. And a good amount of the information on this video tutorial has to do with those section 1 and 2, the case log management and case log reports. So you can fast forward it to minute 40, and this will take you straight to learning about your time logs, which is the first thing that you need to learn. In the TAMU-CC DNP TIFIN system, you will be entering your time by course. All of your time will be associated with the course, and you saw that table in the previous slide. Now you will enter your time as either immersion or synthesis. So in the total shift time, you'll put the whole time for that day. You'll do your time log by the day. And then you'll enter the total time and shift time, but then you will categorize that time by either immersion or synthesis. You also see the MSN credit hours, and that's done at the beginning of the program, and so you will not need to do that after you start the program. So you'll only have 2 choices, immersion and synthesis. Yet the detail will be down in the notes. In the notes section, you'll need to explain the activities associated with the time and how the practice experience helped to meet the DNP essential competencies. So you will actually want to give the DNP essential competency number and explain how this experience helped you to meet that competency. There are a variety of experiences that you will complete in practice as a DNP student, which will help you to meet the DNP essential competencies. And here are some examples, and I will put these in the Doctor of Nursing Practice Organization in your Blackboard, and you can kind of look at them there, collaborating with expert in practice, learning new advanced practice skills, development of a PICO question, serving as a consultant or mentor, engaging in professional committee work. So there's all kinds of different activities that will be counted towards your practice activities. And you can see that these examples are associated with the essential number, and that's what we want you to do too. We'll want you to associate your activities with the specific DNP essential. You saw in the previous screen where there was a category in the time log for MSN verification of hours, or MSN hours credit. So each student is allowed up to 500 hours of credit from their MSN program towards their DNP 1,000 hours required. Now, each student has to get the MSN verification of hours from their MSN program. This document will be uploaded into the Typhon External Documents area, and then those clinical hours will be recorded in the Typhon time log. And I think there's a limit of 100 hours per day in the Typhon time log, and so look towards your course faculty for additional information on getting this done. Students will have the whole semester to enter their Typhon time logs for that semester. Generally speaking, the time logs will close to student entry at the end of the semester. Faculty liaison will review the time logs throughout the semester, and if there's any issues with them, they will go ahead and talk to you about those. And there's not an official designation of approved, not approved, but once they are closed for the semester, they can't be changed unless we have special circumstances. If there are special circumstances, then the faculty liaison will communicate with the student and let them know when those time logs will be available for them to make the adjustments that are needed. And then other than that, no changes can be made after the logs are locked at the end of the semester. As you're in the video tutorials from the Typhon system, you'll want to fast forward to minute 46 so that you can view the video on document upload, how to upload documents, external documents, into your Typhon. Your course faculty and faculty liaison will tell you which documents need to be uploaded, and those documents will be classified by the DNP Essentials. In other words, when you upload a document, it meets one of the essentials and one or more of those essentials, so you'll want to know that before you begin the upload, and the best place to find that information is within your course, because usually the documents that you are uploaded are assignments from the course. Which documents do you upload into Typhon? Which external documents do you upload? You're going to look to your course faculty, your faculty liaison, and your course syllabus to know exactly which documents to upload. And then at the end of the program, these documents can also be used in your DNP portfolio once they're in Typhon. When students go to upload their documents into Typhon, they will select External Document Upload. And in that, they'll have to choose a date and a category. And the categories are by the DNP Essentials, 1 through 8. There's a My Portfolio category and a Project Proposal category. And you will upload all documents for most of the program into categories 1 through 8 of the DNP Essentials. At the end, you'll be doing a portfolio, and in this portfolio, you may change some of your documents to My Portfolio so that they will go into that portfolio. But don't do that until you do your portfolio, because the reason is that these documents are open to all faculty that have access to your account, access to you in Typhon, and if you put them under My Portfolio, they won't be able to see them. And at some point when you're working on your portfolio, you may want to take specific documents and and change their category to My Portfolio so that they will feed into that portfolio, but for now you don't want to do that. The DNP portfolio is a compilation of practice experience details, artifacts, and other evidence that demonstrate the student's development of advanced competencies throughout their DNP program. No two portfolios will be identical because the documents that represent each student's experience will vary depending on their specific learning activities and practice experiences. The complete portfolio must be submitted with the DNP project as evidence of the program completion. It will be reviewed by the student's faculty liaison and DNP program coordinator, and the project advisor will review evidence related to the DNP project. And these DNP portfolios will be completed in Typhon, so you'll have more of an explanation and closer to the end of your program when you're starting to really work on those portfolios. The data and documents that you upload into Typhon will all contribute to your final portfolio. And during your program, you'll want to follow all instructions provided by your course faculty and faculty liaison to ensure that your final DNP portfolio is comprehensive and contains quality information. Additional and specific information about the portfolio preparation will be provided later in the program, like I said. But for now, remember, garbage in, garbage out. You want to make sure as you go through in each semester that you put the right things in there and have good quality data going in, and that way at the end it won't be such a big drop.